Hey everyone, and welcome to this explainer. I'm absolutely thrilled to have you here today because we're tackling something that affects literally millions of people, but is still just so heavily shrouded in misunderstanding. We're going to be demystifying severe period pain, and we're drawing on some incredible expert medical insights from Dr. Koji Hashidi, a highly seasoned obstetrician and gynecologist. So whether you're looking for answers for yourself, maybe a loved one, or you're just a focused learner eager to understand how the human body works, this explainer is designed to give you absolute clarity. We're going to break down the science, the symptoms, and the solutions, all so you can easily follow along. Let's get into it. Okay, let's dive right into this with a question that honestly sounds like it's straight out of a medical thriller. Why on earth would someone bleed from their belly button during their period? Or, in some rare cases, even cough up blood? It sounds bizarre, right? But these highly unusual symptoms are actually the first crucial clues to a fascinating and very real medical mystery. See, when we start seeing symptoms like these, it tells us that something occurring normally in one part of the body has somehow gone totally rogue and ended up somewhere it absolutely does not belong. To get to the bottom of this, here is our roadmap for today. First, we'll uncover the hidden cause of pain. Then we'll answer, what is endometriosis? Third, why it causes so much trouble. After that, we'll look at medication and hormone control, followed by modern surgical options, and finally, we'll wrap up with your personalized care plan. So, starting with part one, the hidden cause of pain. For far too long, society has just normalized severe menstrual cramps, brushing them off as just a normal hurdle you have to endure. But Dr. Hashi emphasizes that this is simply not true. Severe, debilitating menstrual pain is a massive warning sign. Honestly, when the pain becomes so intense that it disrupts your daily life, that's your body's alarm bell ringing. It's signaling us to look deeper. It actually points to a physical cause, specifically rogue tissue that is growing in completely incorrect places. Just like we mentioned a minute ago, this tissue can end up in the navel or even the lungs. The pain isn't just in your head. It's a very real, physical reaction to this misplaced tissue. Moving on to part two. What is endometriosis? It's a term you've probably heard tossed around, but let's bring some real clarity to what it mechanically means inside the body. The core mechanism of this disease is just fascinating. Endometriosis is basically a condition where tissue that is very similar to the endometrium, which is the lining inside the uterus, starts growing outside of the uterus. And here is the critical problem. Even though it's in the wrong place, it still acts exactly like normal uterine lining. Every single month, if a pregnancy doesn't occur, this tissue sheds and bleeds. Inside the uterus, that blood has an exit path. But out in the abdominal cavity or on the ovaries or the lungs, that blood has absolutely nowhere to go. It is completely trapped. Now, you might be wondering, how does it even get there in the first place? Well, medical science actually has two main theories for this. The first is the metaplasia theory. This one suggests that, for some unknown reason, normal tissue completely outside the uterus simply mutates, literally transforming into this endometrial-like tissue. The second is the bloodstream theory, which proposes that actual uterine cells get into the bloodstream or lymphatic system, travel through the body like tiny stowaways, and then implant and grow in these distant, random locations. What's really fascinating here is how the landscape of this disease has totally shifted over time. If we look back, say, 50 or 60 years ago, endometriosis wasn't diagnosed nearly as often as it is now. Dr. Hashini points out two main reasons for this. First, lifestyle changes. The modern shift toward a more westernized, higher-fat diet is actually believed to play a pretty big role in the increasing number of cases. Second, and perhaps more importantly, is just our technology. Decades ago, if you had this rogue tissue, it was incredibly hard to see. But today, we have easy, widespread access to advanced ultrasound, CT, and MRI scans. We are simply so much better at finding it now. All right, section 3, why it causes trouble. So we know the tissue is there, and we know it bleeds. But what is the actual physical toll it takes on a person's body? Well, there are two massive complications that arise from all this trapped blood. The first, as we've already touched on, is intense, debilitating menstrual pain. But the second complication is arguably even more complex, and that's infertility. Because this rogue tissue causes inflammation and trapped blood, it acts almost like a glue inside the body. It can cause the ovaries, fallopian tubes, and even the surrounding bowels to just adhere and stick together. When everything is bound up in scar tissue like this, it makes it incredibly difficult for an egg to be properly released and fertilized. Let's zoom in on the ovaries and see exactly how this builds up, step by step, because it's vital to understand.
Step 1. The rogue tissue grows inside the ovary itself. Step 2. When it's time for menstruation, that tissue bleeds internally. Step 3. Because that blood can't escape, it pools inside the ovary, causing it to swell up significantly. And Step 4. Over time, that old, trapped blood oxidizes and turns a dark, muddy brown color. In the medical world, this is vividly referred to as a chocolate cyst. It's a highly descriptive, very memorable term for a condition that is, frankly, incredibly painful.
Let's turn to some good news in Section 4, medication and hormone control. The reality is, modern medicine has developed some highly effective ways to fight back against this. When you first go to a doctor for severe cramps, you might initially just want some quick pain relief. But standard painkillers, they only temporarily mask the pain. They do absolutely nothing to stop the disease from progressing. Low-dose hormone pills, on the other hand, are a total game changer. Endometriosis acts like a fire, and the hormone estrogen is its fuel. By taking low-dose pills, you suppress that excess estrogen, prevent ovulation, and essentially starve the rogue tissue, literally stopping the disease from getting any worse. But what if the case is extremely severe? For patients whose pain is so heavy that they literally cannot work or function, doctors can use advanced medications that block signals straight from the pituitary gland. This completely halts ovarian function. It essentially puts the body into a temporary, medically induced menopause. And yes, this can cause menopause-like side effects, which is intense for sure, but it is incredibly effective at completely stopping the endometriosis in its tracks for those who desperately need relief. That brings us to Section 5, modern surgical options. Sometimes medication just isn't quite enough, especially if one of those chocolate cysts has grown too large. So the crucial takeaway here is that you should not let the word surgery terrify you, because things have radically changed. Back in the day, abdominal surgery meant being hospitalized for 10 to 14 days and being left with large, painful scars. But today, modern surgery for endometriosis is largely laparoscopic or even robotic. This means the surgeon makes tiny, tiny incisions, drastically minimizing the physical trauma. You're often out of the hospital within just a few days. The physical toll is just a fraction of what it used to be. Finally, Section 6, your personalized care plan. With all these tools, painkillers, low-dose pills, intense hormone blockers, and advanced surgery, how does a doctor actually choose what to do? This perfectly illustrates the modern medical philosophy. There is absolutely no one-size-fits-all approach. A good doctor will sit down and look at your specific life goals. For instance, if a patient says, I want to have a baby in the next 2 to 3 years, well, the doctor might lean towards surgery to clear out those chocolate cysts and adhesions, freeing up the ovaries for conception. But if a patient says, I have no plans for pregnancy right now, I just want my life back, the doctor will likely focus on hormone suppression and low-dose pills to control the symptoms long-term. The treatment is entirely tailored to you and your life. If you're watching this and wondering, hey, should I get checked out? You should know the diagnosis path is straightforward and highly accurate today. It usually starts with a simple pelvic exam. From there, doctors will use an ultrasound, also known as an echo, which can quickly spot if your uterus is swollen or if there's a chocolate cyst forming. If they need a more detailed look, they can easily order a CT or MRI, which gives incredibly high accuracy imaging. You don't have to guess, the technology is right there to give you a definitive answer. I want to take a moment to read this quote from Dr. Hashiai directly from our source material. He says, "We men are truly fortunate. If it's tough, please come see us." It is just so validating to hear a medical professional openly acknowledge the sheer, debilitating weight of this condition. He's reminding us that suffering in silence isn't a badge of honor. His door, and the doors of countless specialists out there, are wide open to help you navigate this. Which leaves us with this final, vital question to ponder. Could a simple checkup change your life? If you're living with intense pain, remember that it is a warning sign, not a normal part of life. As we've seen today, the treatments available are incredibly advanced, accessible, and totally personalized. Thank you so much for joining me on this explainer. I really hope this structured journey through the science has empowered you with the knowledge you need. Keep learning, keep asking those big questions, and never ever hesitate to advocate for your own health.